When a baby appears to be unconscious, you must first verify this condition by gently shaking the shoulder. An unconscious baby will not awaken or cry, and the arms and legs will be limp.
Help! Help! Somebody help!
If someone arrives, send that person to phone for emergency medical help. Obtaining professional medical help as soon as possible is of the utmost importance. Call 911. When you are alone with a baby victim, perform CPR for about 1 minute. Then, if a telephone is easily available, quickly phone for emergency medical help and immediately resume CPR. If a telephone or help is not available, continue CPR. A rescuer can give effective CPR only if the baby is lying flat on his or her back on a firm, level surface such as a table or the floor. If you need to reposition the baby, support the head and neck with one hand and carefully roll the entire body towards you without twisting it. Do not prop up the head. Next, begin CPR by using the ABC steps: airway, breathing, and circulation. Step A, the first step, is to open the baby's airway using the head tilt chin lift maneuver. Usually the tongue is the most common cause of a blocked airway in an unconscious baby. To begin, tilt the baby's head back by pressing on the forehead with one hand, using slight gentle pressure. Be careful not to overextend and possibly close off the airway. Next, place the fingers of the other hand under the jaw on the bony part of the chin. Avoid pressing on the soft tissue under the chin, as you may accidentally block the baby's airway. To complete the airway opening maneuver, gently lift the chin upward. Step B, the second step, begins by checking to determine whether the baby is breathing. Keep the baby's airway open. Put your ear directly over the mouth and nose to listen and feel for breathing. At the same time, also watch the chest and stomach for any movement. Look, listen, and feel for breathing for 3 to 5 seconds. If the baby is breathing, keep the airway open until help arrives. But if you do not hear breathing, do not feel exhaled air on your cheek, or do not see the chest rise and fall, you must keep the baby's airway open and immediately start rescue breathing. First, take a breath. Open your mouth wide and place it over the baby's mouth and nose, making sure you form a tight seal. Next, give 2 slow breaths, known as rescue breaths. Allow 1 to 1.5 seconds for each breath, with a pause between breaths for the rescuer to take in fresh air. Out of the corner of your eye, watch the baby's chest. If the chest rises and falls, you'll know that your rescue breaths are effective. Give only enough air to make the baby's chest rise and fall. If you meet airway resistance when administering the 2 initial rescue breaths and do not see the chest rise, you must reposition the airway and try again to give the rescue breaths. If you still meet resistance after repositioning the airway, a foreign object, such as a hard candy or a small toy, may be causing an airway obstruction. Before continuing rescue breathing, you would need to remove the foreign object from the airway. Later, we'll show you how to do this. After successfully giving the 2 rescue breaths, Step C, the third step, which is circulation, begins by feeling for a pulse. To check the pulse of a baby, place your middle and index fingers on the inside of the baby's upper arm and press gently for 5 to 10 seconds while feeling for a pulse. When there is a pulse, but the baby is not breathing, only rescue breathing is necessary. Give 1 rescue breath every 3 seconds or 20 times a minute. When a baby is not breathing, and you also determine there is no pulse, you must combine rescue breathing with chest compressions. To find the right place to do chest compressions, imagine a line drawn between the baby's nipples. Then place the index finger of your hand farthest from the baby's head, just under the imaginary line in the middle of the breastbone. 1 finger's width below your index finger is where you do chest compressions. Use 2 fingers, or for a larger baby, use 3 fingers to compress the breastbone downward 1/2 to 1 inch. The CPR pattern for a baby is 5 chest compressions to 1 rescue breath. Count out loud while doing the chest compressions.
1, 2, 3, 4, 5.
Then give a rescue breath.
1, 2, 3, 4.
The chest
5.
compressions are at a rate of at least 100 times a minute. Keep the compressions regular and smooth.
5. 1.
Avoid rocking or jerking movements.
1, 2.
Do not lift your fingers off the chest.
1, 2, 3, 4, 5.
Allow the chest to return to its normal resting position after each compression.
1, 2, 3, 4, 5. 1, 2, 3, 4.
If at any
5.
time during CPR the baby vomits, turn the baby onto his or her side. Support the neck and clean out the mouth. Restart CPR with a rescue breath.
1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5.
When you are alone with a baby victim, perform CPR for about 1 minute. Then, if a telephone is easily available, quickly phone for emergency medical help and immediately resume CPR. Restart CPR with a rescue breath.
1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4.
Continue CPR until the baby has a pulse and is breathing.
4, 5.
Once there is a pulse and breathing, continue to keep the airway open and watch closely, making sure the pulse and breathing don't stop again. Continue rescue procedures until help arrives. We will now review the CPR steps for babies.
Are you okay? Are you okay? Help! Help! Somebody help!
Position the baby onto the back. Open the baby's airway. Look, listen, and feel for breathing for 3 to 5 seconds. Give the 2 initial rescue breaths. Check for a pulse. If there is no pulse, begin chest compressions.
1, 2, 3, 4, 5.
Give 5 chest compressions
1,
to
2,
1
3,
rescue
4,
breath.
5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5.
In addition to knowing how to do CPR, it is also important to know how to care for a choking baby and how to remove a foreign object airway obstruction. However, you should not confuse a foreign object airway obstruction with